Good afternoon, everybody. Today is Thursday, December the 17th, 2020, and I want to be updating you on COVID-19. So in Canada, we have 48,006,393 cases that's confirmed in Canada. Alberta has 84,597 cases, 760 deaths. British Columbia has 44,103 cases, 692 deaths. Manitoba has 22,047 cases, 537 deaths. New Brunswick has 573 cases, 8 deaths. Newfoundland and Labrador has 367, 4 deaths. Nova Scotia has 1,436 cases, 65 deaths. Ontario has 14,008,967 cases, 458 deaths. Prince Edward Island has 90 cases, 0 deaths. Quebec has 17,001,028 cases, 7,635 deaths. Saskatchewan has 12,832 cases, 105 deaths. Northwest Territories has 22 cases, 0 deaths. Nunavut has 259 cases, 0 deaths. And Yukon has 59 cases and 1 death total. So these are the cases that we have in Canada. Now I'll be moving on talking about Alberta numbers, because the numbers are really huge when we talk about the numbers of Alberta. So that's everything you need to know on Alberta on Thursday, December 17th. So Alberta is expecting rapid testing. Alberta is expecting rapid testing for COVID-19 to long-term care faculties and rural hospitals. Health Minister Tyler Shandro announced Thursday COVID-19 has now killed more people in Alberta than influenza did over the last 10 years. Combined, 760 people since March, Dr. Dina Hinshaw, Alberta's Chief Medical Officer of Health, warned Wednesday. Hinshaw specifically target people aged 20 to 40, reminding them they're vulnerable to the virus. More than 32,000 Albertans in that age group have contracted the virus. Hundreds have been hospitalized and a number have died. Doctors say they are in day-to-day survival mode as Calgary ICU stretch the surge. On Wednesday, 1,270 new cases were reported. The province has 20,169 active cases and a test positive rate of 7.3%. There are 749 people in hospital, including 139 in intensive care and 16 more deaths. 19% of schools in the province, 452 schools are on alert or have outbreak with 1,964 cases. There are 982 active cases and 3,682 recovered cases at long-term care faculties. Hinshaw will give an update on the pandemic in the province Thursday at 3:30 p.m. The province said earlier in this week that it would send COVID-19 care team to 11 worst hit communities, 9 in Edmonton and 2 in Calgary, all of northeast Calgary, east of Deerfoot Trail. They'll deliver care packages, provide information in multiple language, and arrange on-the-ground support and safe transportation to COVID-19 assessment faculties. The province has set up 16 self-isolation hotels that will provide a free stay and food for 14 days, 6 in Calgary and 9 in Edmonton and 1 in Peace River. The Calgary hotels have capacity for 791 people, and in the Edmonton hotel can accommodate more than 1,300. Premier Jason Kenney said on Tuesday those who self-isolate at the hotel will also be eligible for temporary financial aid in the amount of $6.25 at the end of the stay. The province received 3,900 doses of Pfizer BioNTech vaccine on Monday and expects to get another 25,350 doses at the start of next week, officials say. Alberta plans to administer doses of COVID-19 vaccine to 29,000 healthcare workers by the end of December, the province has said. During the first quarter of 2021, Hinshaw said Wednesday the vaccine will be given to long-term care residents, staff who work in long-term care, and designated supportive live, living centers, health care workers in the high-risk areas of the hospital, and people over the age of 75. Alberta Health will publicly report the number of people who have been immunized. People will receive a paper document and their immunization history will also be part of their electronic health file. Detail of the vaccine and Alberta plans to date can be found here. The province is expecting rapid testing for COVID-19 to long-term care facilities and rural hospitals, Alberta Health Minister Tyler Shandro announced Thursday. Rapid test kits will first be developed to long-term care facilities and designated supportive care facilities in Edmonton that are contending with outbreaks, Shandro told on Thursday morning news conference. Mobile units will be developed in Edmonton starting Friday. The test will be used on residents who are uh, exempting symptoms. Mobile testing centers are expected to be ready to develop in the Calgary zone starting the week of December the 21st and are expected to focus initially on sites with outbreaks. On Wednesday, 1,270 new cases were reported. The province has 20,169 active cases, a positive rate of 7.3%. There are 749 people in hospital, including 139 in intensive care. Alberta reported another 16 deaths on Wednesday, bringing the total deaths during the pandemic to 760 since March. COVID-19 now killed more people in Alberta than influenza did over the last 10 years combined. In Alberta to date, more than 32,000 people between the age of 20 and 39 have contracted COVID-19. More than 380 of them have been hospitalized, and sadly, 8 of these have died. For everyone of any age, including those between the age of 20 to 39, is virtually to avoid in-person interactions whenever possible. That includes not having holiday parties or other gatherings in your homes. Instead, we must all look for a way to contact virtually. Calgary's ICU is below 100% thanks to the addition of 30 beds, which increased capacity. It's part of the Alberta Health Services surge planning, but it isn't not clear how much more wiggle room there is. It's really is the day-to-day survival mode. A specialist who works in 3 of the Alberta ICU and ICU doctors have previously told the surge plans put in place to deal with the soaring COVID-19 case, including 40 beds for Calgary that could be put into use in batches of 10. The latest batch of 10 was released on Friday, bringing the total number of ICU beds in the zone to 96. According to the AHS, the Calgary zone is currently sitting at 82% in the term of ICU usage and has hovered between 90 and 100% in the recent weeks. Alberta Health Services and the Red Cross are setting up 100 beds temporary hospital in the University of Alberta, says the province chief medical officer of health. There is no plan to staff these beds unless they are needed, said the daily COVID-19 brief on Wednesday. This is a purely precautionary measures for use if needed in the future. Branded as alternate care centers, the temporary setup on the University of Alberta campus could be used for patients recovering from COVID-19 and who are at low risk of transmitting the novel coronavirus. causes the disease, Alberta Health Services spokesperson Kerry Wilson said in an email. On Wednesday, Hinshaw retreated the safety and benefits of the Pfizer-BioNTech vaccine as healthcare workers began to receive the first dose. Canada has one of the most robust regulatory systems in the world, Hinshaw said, and no steps were skipped in the approval process. The phrase of the province vaccine program, which provided its initial dose on Tuesday, will target people who are at the high risk of severe outcomes and those who care for them. During the first quarter of 2021, vaccine will be given to long-term care resident staff who work in long-term care and designated supported living centers, healthcare workers in high-risk areas of hospitals, and people over the age of 75. The province Here is the regional breakdown of active cases reported on Wednesday. Calgary zone has 7,122, down from 7,331 reported on Tuesday. 25,754 recovered. Edmonton zone has 9,715, down from 9,946. 26,071 recovered. North zone has 1,245, down from 1,250. 4,337 recovered. South Zone has 553, same as the previous day, 435 recovered. Central Zone has 1,458, down from 1,496, 3,328 recovered. Unknown has 76, up from 73, and 143 recovered. Ontario reported 2,139 new cases of COVID-19 on Wednesday, with 43 additional deaths, bringing the death total to the province to 4,035. Hospitalization also climbed, hitting 932, with 256 COVID-19 patients in intensive care. People are finding it too easy to move back and forth and do things we're discouraging them from doing, Tory said. In Quebec, schools are closed and most office workers will be working from home from Thursday until at least January 11th as new restrictions kicks in. Health officials in the province reported 1,897 new cases of COVID-19 on Wednesday and 43 additional deaths, bringing the province death total to 7,613. Hospitalizations in Quebec increased to 975, with 128 people in intensive care units. In Atlantic Canada, New Brunswick reported 8 new cases of COVID-19 on Wednesday. Newfoundland and Labrador reported 5 new cases, and Nova Scotia reported 4 new cases. There were no new cases reported in Prince Edward Island. COVID-19 vaccination effort got under Wednesday in all Atlantic provinces except for New Brunswick, which is set to begin its campaign on Wednesday. Health officials in Manitoba reported 292 new cases of COVID-19 on Wednesday and 15 additional deaths, bringing the death total in the province to 523. Manitoba got its vaccination effort underway Wednesday and plans to give 900 healthcare workers the Pfizer-BioNTech shots this week. In Saskatchewan, health officials reported 129 new cases of COVID-19 and no additional deaths, and new restrictions stating that people in the province can no longer have guests in their homes goes into effect Thursday, along with several other public health rules, and will remain in force until at least January 15th. In British Columbia, health officials reported 640 new cases of COVID-19 and 16 additional deaths. There are now been 692 deaths in the province since the pandemic began. A joint statement from the Provincial Health Officer Dr. Bonnie Henry and the Health Minister Adrian Dix says 409 doses of the COVID-19 vaccine were administered on Tuesday, and the province expects to see weekly vaccine delivery starting next week. So these are the COVID-19 numbers that we have across Canada. So it's very important that people follow the health rules, they follow the health guidelines because these numbers are going to be crazy, and we're going to see numbers like that keep going up every week, right? I also announced new restrictions for my school yesterday, and that includes um, the mandatory mask will be mandatory starting March 20th, 2021. Mask will be mandatory and everybody will be have to wear the mask, including my students are going to be wearing the mask starting on March the 21st, 2021. So it will be mandatory. You have to wear those masks and it's a must. So that will include also I'm going to be allowing only 5 students that are going to be coming to the room, and it's only going to be 5 students. I'm not allowing anybody else to come to the room, so it's only 5 students. If you do not come early, then you're not gonna have a space. You have to be one of the early students to come, and I'm just accepting 5 students. I don't care who comes first, but only I'm allowing 5 students to come to the room, and the rest are gonna be doing online. So that will be taking effect on March 20th, 2021, because that's when I'm actually going to open the school, and this is where those restrictions are going to be taking effect. Also, vaccine will be mandatory for all my students to take for them if they want to be in school and be learning in school. But if they decide not to take the vaccine and they see the vaccine, they don't want to take it, they don't see it safe, then in that point, the vaccine, nobody has to take it. If you don't want to take the vaccine, then you're not going to be able to come to the school. So if you really want to take the vaccine, then you're gonna have if you really want to come to the school, then you're gonna have to take the vaccine or you won't be able to come to the school. Is a new restriction that I put in place on March 20th, 2021. So that's a rule. You have to follow the rules. If you don't, then you're not gonna be welcome to come to the school. Also, students they must bring their own technology and bring their own supplies. I'm not providing any technology in this room. I'm not providing any supplies. Everybody's responsible to bring their own devices, um, their own supplies, because if you're doing any schoolwork, it's your responsibility to do that. Especially now this COVID, I'm not providing anything. So your responsibility to make sure that you're responsible enough. You bring your own supplies, you bring your own things. Is that clear? So that also will take effect on March 20th, 2021. So all these restrictions are must be followed. And the only restriction that I put in place today, and that will include the camera. Your camera have to be on, especially tomorrow. For my students, you guys have a unit exam for unit 1 and 2 for the English, and your camera have to be on. If your camera is not on, then I won't count the mark. You'll get a zero in that exam. It's that simple. You can't be going to the washroom and you expect me I'm going to be counting the marks here. I'm not going to give marks if people are not serious enough. Because if your cameras are not on, I can suspect that you are cheating in the exam. You're not doing the exam accurately, and I can think that way. So it's very important that you have to make sure that your camera is on at all times, so I can give you a mark. And you can't be wandering off. You can't be looking at your notes or anything. You have to look straight at the computer when you're doing the unit exam. You will be tested on unit 1 and unit 2, so you have only today to study for the unit exam because tomorrow I'll be giving that exam. So it's very important that you be prepared for it so you can get a good mark on it. But again, if you need to go to the washroom, do that in the beginning. Do not do it at the end of the do not do middle of the exam, because I can suspect that you're going to get notes and you're planning to cheat, and the exam I don't know if you're cheating or not, because now this is online. I don't know, right? If it was in person, maybe I can tell if you're cheating or not. But this is online, I can't really tell. But by you moving around, you're giving me that chance by thinking that you are cheating and you're not taking the exam seriously. So these are the kind of things, right? Camera has to be on. This is already a restriction that I already put in place today. So you have to have it tomorrow. If you don't have it tomorrow, you get a zero. If your camera is not working, you have tonight to figure it out. You have tonight to figure out if your camera is working or not. But tomorrow, if you don't have it on, does not matter. Even in the future, in January and February, you have to have it at all times on. Is that clear? As long as you're not in person, you then have to have your cameras on. But once we go back to school and back to life normal, and that will be either maybe June or July, we're gonna have like I'm gonna have normal amount of students. Now I'm just gonna be allowing 5 students starting on March, end of March. That will be during the spring break. I'm gonna be allowing only 5 students to come. But once things get better and numbers go down and things get better with the COVID, then I'm gonna allow more students and slowly like that. I'm gonna allow 10 students, then I'm gonna be allowing 15 students, then we're gonna allow 20 students like that until we have the normal amount of students that's supposed to be in the class. That will take all time, but until then, it's very important that you follow the health rules and also you follow the restrictions that I put in place yesterday. Those restrictions have to be followed. Do some of the, like I said, the camera restriction has to be uh, followed regularly, and the other restrictions are going to be starting on March 20th, 2021, and those restrictions they again have to be followed as well. Exactly. If those restrictions are not going to be followed, you're not going to be welcome to come to the school because I don't need people not following masks have to be mandatory. You have to bring your own supplies and all that. If you're not, if you can't bring your own supplies, you can't wear the mask, and if I'm allowing 5 students and you try to come and come here, um, you also have to bring your own hand sanitizers and stuff. And if you don't do none of these restrictions, not if I don't see one restrictions you are following, then we're gonna go back to a lockdown. I'm gonna be closing the whole school again in March or maybe even April if I don't see people are behaving properly. Because I'm giving people opportunities. Some people they want to go back to school, and I'm giving that chances now. But if I see that people are not following the restrictions and they're not following the health rules, then we are gonna close the whole school again. So people don't want that. So they all they have to do is just follow the health rules, follow the health guidelines. Then I don't have to close anything. It's that simple, right? Because even March, I don't even know if it's really a good time for me to open school even that time, right? I still not feel comfortable much about it, but because the vaccine came now, things might get better, right? We might get more. We are going to get more vaccine through the winter break and end of December, and also in the New Year's. We are getting more of that vaccine. Moderna is just arriving next week, and we're having more vaccine. So that's the reason why I'm opening schools for. But again, if people are not following the health rules and they're not following the restrictions that I put in place, then there will be a consequences on that. And the consequences will be we will shut the whole school down again. So if people don't want that, you have to make the right decision and making sure that you protect your health and making sure that you follow the health rules. It's that simple because if you follow the restrictions, you follow the health rules, we will end this COVID soon. For other people, other than my students, make sure you follow the health rules and you follow the health guidelines because it's really important that that's so important. By us following the health guidelines and protecting ourselves with the vaccine, things are going to get better. But this will take time. Is there any questions that has to do with the COVID or has to do anything about the restriction that I announced yesterday, or anything that you want to comment about it? Because I'm willing to comment about anything that I just talked about right now. Right, the restrictions are really clear. I made them really important, and you have to follow them. You don't, there will be consequences at the end, right? This is something because in 1 week, like when I open the school on March 20th, that first week I'll see how many people are following the restrictions, following the health guidelines, and I'll make a decision. If I see things are not going that well, then we will close the whole school again because until Alberta becomes a safe province and there's no COVID and everything, then then we'll allow masks not to be thing, right? But the mask now is mandatory. Not only in my school, is mandatory everywhere now. Everywhere you go, there's mask to wear. So mask is really important, especially in schools. You have to wear them because if you don't, you're breaking the government rules and you're breaking my rules too because I put in restrictions. So it's very important that you follow that. Make sure you bring your own hand sanitizers, your own devices, your own supplies. Nothing will be provided from the school, right? Because really, if I give you devices and I give you stuff, then I have to clean each one of them after each student uses. It's a lot of work, right? So it's easier for everybody to bring their own devices and their own supplies. So I don't have to provide those stuff. I don't have to clean after my belongings. So I don't have time. I'm a teacher. I don't have time to go and clean after people. So it's your responsibility. If you don't have the device, you don't have the thing, you're not going to be able to learn nothing, right? Not providing you anything because sometimes people students forget their own supplies. You have to make sure regularly every day you have it with you. Because if you don't, when exams come and assignments come, you're not gonna be able to take notes, you're not gonna be able to do anything. It's gonna be too bad for you, right? And that restrictions I'm gonna put place maybe until next January or maybe until when, right? It will be a long time. These restrictions are gonna be at least for a couple of months, like maybe March until uh, maybe next December or maybe next January. I will put that maybe until next March. Maybe I'll put those restrictions a year, right? So I don't know how long those restrictions are gonna last, but they're not gonna last for a month. They're gonna last more than a month, just to let everybody know. Because for us to go back to life normal, it will take a couple of months, maybe even a year, because COVID doesn't just leave like this, right? We saw how long just we had it from last March until now. So in Alberta, our numbers are really high from the time March came until now. So if our numbers are super duper high, then the higher the numbers are, the higher it will take for us to go back to the life normal. So that's why it's really important that everybody does what they can and do what we can so we can go through this fast and then numbers can go down. But like I said, when I read those numbers today, those numbers were accurate numbers. They were high numbers. Still, Ontario has a lot of numbers. Although vaccine came already this week. Like I said, things don't kick in quickly. They take time to be kicked in. They take time for to see some reaction to see what happened with the vaccine. You know, so for it to kick in, it will take at least a couple of months to see the result of the vaccine. What it did. Did the numbers improve or not improve? That's how we're gonna know. You're not going to know in 1 week or in 1 month how the numbers are, right? This will take time. So that's why I'm saying it's very important that people do what they can and they follow the health rules and they follow the health guidelines because it's not hard at the end of the day. It's simple to follow health rules and follow health life, but there's some people out there that make it complicated, that make it hard for themselves. And it's not hard. Following health rules is the easiest thing. It's not hard. It's not complicated. But there's people out there, like I said, they make it complicated for themselves. It's how much you care. There's people they don't believe in COVID, and also the people that died because of COVID. And I'm pretty sure the people who died of COVID, some of them are people that did not care about their health. And like I said, this COVID-19, we're almost done at 2020. We're almost done this year. This year it was hard for us. It was difficult. It wasn't an easy year for us, right? But right, because this COVID started last December. Actually, this is a year now from the time COVID we had it, right? And it's shocking that we're getting a vaccine after a year. So that tells you that this is improvement, and people are really working really hard to develop vaccine and making sure our health and safety is really important, right? So it's been a year, and we were able to get a vaccine in a year now from the time the COVID started, and now the COVID will end soon. But what I want to talk about is that's why it's very important, right? And following the health rules and following the health guidelines, like I said, is really important. And it's not hard thing. Some people they take it very they don't understand the benefits of the health and the benefits of people's health. And it's just that simple. At the end of the day, how much you put in and how much you put out, that's what really matters at the end of the day. It's not uh, uh, time using is very important that everybody takes the time using seriously and not joke around with the time when things are. So it does not matter what the things are. But what I'll advise you is uh, you do what you can, right? And if you don't want to take the vaccine, I understand. But I'm just gonna tell you that you're not gonna come to the school because the vaccine now is the only protection we have among each other. That's why I'm saying the vaccine. Now vaccine are gonna be mandatory in workplaces, are gonna be maybe schools next year, they're gonna start having vaccines. But I'm saying vaccine, you're gonna have to take a shot if you're gonna come to the school. But if you plan to stay home and you some people, some Albertans, they don't want to take vaccine, and I understand. If you don't want to take a vaccine, you don't have to come to the school, right? School won't be open for you. You can just continue doing online learning and it's safer that way because I don't want people just to come to school without taking vaccine, right? Maybe contract with somebody who has COVID, and I don't know, especially now the numbers are really high. We're not talking about like 5 cases or 10 cases. We're talking about 1,000 cases and 20,000 cases a day and nationally as a province, right? So these numbers are really scary. So the reason I want my students to take the vaccine is because it's not safe out there. And I don't want to have outbreaks. So many schools now so far, they have outbreaks and they have to close down because they had a staff had a COVID or they had a student had a COVID. I don't want to be doing that. I don't want to be closing school because have to make it safer is important just to have a vaccine, right? So if you plan to come to school and you want to be coming to school, you're gonna have to have the vaccine. And also remember, I'm allowing only 5 students to come. I'm not allowing more students to come. So if you're not the first 5 to come to the school, you're gonna have to do online. Maybe not gonna get every time chance to come to the school because I'm just allowing 5 students. So it does not matter. But if you're gonna come, if you're planning to learn at school and you're thinking that's better, some people they thinking they hate this online learning badly, and I understand, right? But if you want to come to school, then like I said, vaccine is mandatory. Okay, and that's what's really important. The vaccine for us to come to the school either we're going to be maybe beginning of March. I'm hoping I'm going to order some vaccine to come in March, and by March hopefully we'll arrive to the school, and the students will be must have to take it and whatever. But mask still will be mandatory. Mask is not just because we have vaccine now. That does not mean the mask is going to be gone for good. No, mask is still going to be mandatory and by law. And government already says so. I'm saying so. So mask will still be mandatory. Mask. I'm assuming mask will be gone hopefully by July or August, or even maybe late September. That's when vaccines, masks will be gone. But until then, we're gonna have to be wearing masks. So don't think too high and thinking, oh, we got vaccine today, or we got vaccine this week, we're getting more next week, so we don't have to worry about masks anymore. No, masks still gonna be mandatory, and that's not something going to change. We just have to do what's right and protect ourselves and do what we need to do at the end of the day, because there's no going back to this at the end of the day, right? And our health is more important. And what I learned from this COVID is my health is really important. I should not joke around with my health because sometimes we joke around with health. We don't take our health seriously. This is this kind of crisis. We should learn from it for it not to happen again, right? And 2020, like I said, it was a tragic year, and I'm looking forward to 2021 to become a good year and a positive year. And that won't be easy. But 2021, we hopefully COVID, because really the COVID really started in December. For it when it came to Canada, it came in January, so it's not really a year yet for us. But the COVID, when we knew about it, I knew about it from last December, and it was like end of December is when I actually knew the COVID. So it is actually a year now that we have this COVID, but that does not mean it's gonna go right away, right? We got a cure for it after a year, but that's really impressive, right? Because the World Health Organization said we're gonna get it in January. We're gonna get the vaccine in February. We're gonna get the vaccine. That was their prediction. They didn't expect we're gonna get it in December, but we're lucky that our federal government they put a lot of effort and work to bring the vaccine to Canada at the end of the month, and that's really impressive of our government. It's better than JC Kenny's government doing cuts and doing anything like. At least our federal government did a lot during the pandemic, and that's what the government's job is. It's supposed to support people, support in a time of crisis, and they did that. They won that part. Right? It does not matter what you do. People are not gonna forget the time you helped them and the time you you cure them. That people are not gonna forget that, and That's what our federal government did during the time of pandemic, and I'm impressed with the federal government because they did the right thing during the time of pandemic. People do need vaccine, people need stuff, and we gained vaccine really quick, right? And we are the early countries now to get a vaccine. Some countries still did not get a vaccine. It's only America and Canada that got the vaccine now. But there's still some vaccines, like I said, that not the whole world got it yet, right? So we're very lucky. We are one of the first countries to get a vaccine, and that is good for Canada and good for the country, right? And now the vaccine came. Still, we should follow the health rules and do what we can because if we do our part and the vaccine does our part, then we can be able to break this COVID away. But if the vaccine, we just give it every day. And imagine the government says now, take off your mask, you don't have to wear a mask anymore. This COVID is not going to go. So we still need to follow the health rules, although we have the vaccine, but the COVID is not over, right? We still, our numbers are really high every day. Still, people are dying today, we're dying yesterday, although we have the vaccine, like I said, right? This will take at least a month or two to see progress, to see some change, right? You're not going to see progress in 1 day or 2 days. So that's something I want everybody to really understand that this will take time, but we need to be impressed that the year is done, right? 2020 was a bad year for all of us with the COVID, with everything, but 2021, trust me, will be a good year for us. Life will go back to normal. That will be the year that we're going to go back to life. That's the year that we're going to enjoy it. That's the year that we are going to, only 2 weeks left of 2020, and that will be a great end of the year. But I'm impressed that we got it before the year ended, the vaccine, and that is huge, right? New Year's will be an impressive month to start January with having a vaccine and having of COVID, right? Also, I want to talk about that today, tomorrow it will be my last video to record. So that means next week there won't be any more videos, right? Because it's winter break. I'm taking break from recording videos at least for 2 weeks. So just to let everybody know that tomorrow, if some people are looking forward to this video tomorrow, I'm saying tomorrow is going to be the last video that I'm going to be recording. So make sure if you want to watch it, make sure you show because there won't be another video until January. So January, hopefully the second week of January or the third week of January, we're gonna have new videos. But during the winter break, I don't wanna. I'm taking break from videos and stuff, so there won't be any more videos. Tomorrow is the last video I'm recording, and we are done with videos. So make sure that make sure if you're looking forward for tomorrow's videos. Tomorrow I'm starting way earlier for my video. I'm gonna be starting at um 8 o'clock or maybe at 8:20 tomorrow. Tomorrow I'm gonna be starting at 8:20 my videos, just to let everybody know. It's gonna be really early, but maybe some of you guys are not gonna be able to watch it because maybe you have things to do during that time, but I'll be recording it early, right? Fridays I usually record it early, so tomorrow I'll be recording it at 8:20, not 2:30. Usually every day I record it at 2:30, but tomorrow it will be at 8:20. The video will be recorded. So just to let everybody know that if you're planning to watch the video tomorrow, it will be recorded that time. So that's something that if you're looking forward to. If you're not, you're not. But it will be the last video, and then the winter break will be gone, right? Um, so there's nothing to discuss in next 2 weeks. But like I said, Moderna is coming next week. That will be really impressive. And also, Johnson& Johnson, they're gonna come in March, and there's more vaccines gonna come in the next couple of months. That's why I'm saying this COVID, this mask, and this restrictions and this guidelines are still going to be in effect until we go back to the normal life and to the normal living way, right? Because this will take very long time. But like I said, we have to be ready. We have to put all our effort. We have to do everything, and that's what will take. If as long as we are stubborn and we don't follow the health rules and we don't have to follow everything, like even Dr. Dina Hinshaw, they said how many people died from March until today is really devastating. And I agree, it is upsetting that she just realized now. She had realized earlier before every day she reports COVID-19 cases, and she should realize something about it earlier, but she didn't, right? So I'm saying it is really devastating when you see that kind of stuff, right? When you see the numbers are really high, especially in those provinces, is really devastating way to see it. And like I said, we have to just do what we can and making sure that we do what's right at the end of the day because there's no going back to this, right? And this COVID, like I said, at the end of the day, is leaving us now, but we have to make sure that we learn something from this COVID. And what we're supposed to learn from this COVID is our health. Our health is really important to learn from this COVID-19, right? It came, we had H1N1, we had SARS, we had so many. And this was the deadliest disease that we have than any other disease that we had in the history, right? Because we had SARS. SARS did not last this long. The SARS just maybe lasted until the winter months, and then in the summer it died. But this COVID, it started from last January and continued the whole summer, and now we're still in winter and still exist. So I told you, they are in the same category, right? But it's lasted way longer. This disease, and we have to do what's right, right? This disease was difficult. It lasted really long. We couldn't do much from last January until this December, and I'm saying that. Uh, this is a huge lesson from this COVID-19, right? Because it's way worse than SARS, it's way worse than H1N1, any other disease that we had in the history is way worse. And even that Dina Hinshaw, she already announced yesterday that this disease itself is terrible. And I agree, it is terrible. But that's why we have to take it very seriously because uh, people out there, they didn't take the COVID. If some people they experienced already SARS, they experienced H1, they think it's the same kind of thing. And some people died because of it. Some people uh, lived out there. They had to go to the hospital. And this disease is really deadly, right? And that tells you that now what I noticed about this COVID is what I learned from this COVID is my health is more important than my education, than my work, than anything, right? That's just a wake up call for us to realize that our health is really important. We need to take our health very seriously. So a lot of people they don't take their health, they take it as a joke. Some people even they make fun of this health. And now when this COVID came, hopefully these people that made fun of the health or they did anything, they woke up from this. This is this is a wake up call that tells us we should care about our health. We shouldn't take our health as a joke. Some people they take it as a joke. Oh, I have a cold today. Doesn't matter. Or they have a severe uh, um, severe lung cancer, or they think they're gonna survive, or they're too stubborn even to go see a doctor or doing anything. See, and COVID like this can damage a person and it can ruin them, and people die because of it. Some people survive because of it, right? And it's not easy. So I'm saying that that's why we shouldn't joke around with it because this is the deadliest disease that we had, and we don't know in the future there's going to be any more disease, but every maybe 2 3 centuries we have some kind of a disease, and SARS was just beginning of the 2000s, and now we were in the 20th century, and we still have COVID now that came, right? And that's what I'm saying is one of the hugest disease that impacted everything. Like SARS did not impact the economy, did not impact everything. Like you can see SARS did not do much damage than COVID did. So it is devastating. That's why I'm saying people if people live the time of SARS and they know how SARS is, people should know now that this COVID is way worse than SARS. And it's scary, right? Because killed more people this COVID, ruined people's life, people lost their lives, and it's sad, right? And imagine you losing a family member, or losing a brother or a sister or anybody. It is devastating. So I'm just saying that we need to make sure we do our best by protecting ourselves. We shouldn't take this as a joke. Not a lot of people are going to agree with me, but that's the fact. We know this killed more. This SARS did way more damage. We know all the facts of this disease. What we need to do is we need to do the right thing, and we need to protect our health. That's what's really important about this thing, and that's what I expect everybody to do. Right? Common sense. There's people gonna follow. There's people that don't care about it. That's how much you care. How much you care about yourself, your health. How much you want to put the effort in it. That's what really matters. So think about what I'm talking about. But what I'm talking about is facts. I'm not making up stories or facts or anything. This is facts. You can Google it, you can see it in the news. how many people died from March until uh, December. A lot of people, because this is the worst disease that lasted this long, right? There's no disease that lasted this long. Like when we had uh, what do you call SARS, and we had other stuff. SARS just lasted only like maybe like it started maybe in December and lasted maybe until March. And then by March, people got recovered. By the time summer came, the disease got died because of the heat, but COVID wasn't able to die during the summertime. So we had about plus 30s, we had all those temperatures, but it didn't do anything for the disease. So I'm saying this disease is very strong than SARS. And right, the vaccine came finally now, right? Um, but yeah, right? Even when we had SARS, we had vaccines. That people have to wait the vaccine like now, right? Canada had to wait vaccines, right? And again, that time the Liberal government were bringing the vaccine. Like now we have Justin Trudeau, so Liberal government were in power in that time too, and that was in 2000, a century years ago. I wasn't around during the SARS time. I was around, but I wasn't. I was really. I was like a child that time when SARS was around. Now I'm around during the COVID time, and it's a crisis I'll never forget, and nobody should forget about this COVID because it is a devastating. It did a lot of harm to us. It will be in history. This disease, right? Like SARS is in history. Everybody knows SARS. Everybody knows H1N1. COVID-2 is going to be something that's going to be known as history. Even in the 18th century, we can know how many diseases were when we learn about wars and everything, there was disease at that time. And we all know them, right? We learn social studies. So these things, these diseases are always are known in histories, right? So people, because it's something like if there's a war, people are never going to forget. And if there's diseases, people are not going to, especially if diseases impact the economy and did a lot of damage, people are not going to forget these things. So I'm saying that's the same thing when this COVID came now it did the same kind of things like a war, right? We're fighting with it. It's like it damaged our economy, damaged everything, ruined everything, right? For everything to go back to life normal, we just have to be patient. Now we have the vaccine, that's the good news. But again, we have to wait until everything becomes really safe, right? And when things become safe, I'm talking about numbers here. I'm talking about like our world numbers have to be 0%. When our world doesn't have no cases, then we can go back to life normal, enjoy the life, and do whatever we want. But until then, I know everybody's looking forward to go back to life normal, but that either going to take a year or either will take a couple of months. We don't know how long this will take. It take until June or either by the fall, by next fall. But we do not know exactly. It won't be in February, it won't be in March, that's still too early, but maybe by June or maybe by July. There are some people thinking by June things should go back to life normal, but we don't know yet, right? Mask school will be mandatory until that time because we don't. If now we're still seeing people dying a day like crazy, if numbers don't improve by June, then we're still gonna be continuing like this, right? But if we see improvement, then numbers are going to go down. Then we can see some kind of accomplishment happening, right? So that's why I'm saying that people shouldn't joke around with this and take it very seriously and not joke around with the health because this is a wake up call for all of us. It's not just for me. And that just tells us that we need to just do better with our health and take it way more serious, especially after this COVID. This is the first thing we should learn from it because this can experience again in the future, right? This can happen again in the future. Maybe another disease comes or anything. I hope not, but I'm just saying if that happens because we had already 2000, we had a disease, and in the 1900s we had another disease. So it happens already, right? So I'm saying this is something we need to learn from it and be more prepared for it in the future. More prepared for it, that means we need to make sure we eat healthy. We eat healthy. We eat organic. We eat all type of healthy foods. We make sure our body is healthy. That's what we need to learn, right? Because it was a tragic year, but we need to do that because when a disease comes next time, disease cannot attack you if you're healthy and you're eating healthy and you're taking vitamins and minerals. Vitamins, especially vitamins, vitamin C, vitamin, all type of stuff. Eating organic, eating healthy stuff is going to not bring any disease close to you or even attack you. That's what I advise people. People can choose to listen to my advice or not, but that's what I'm saying. That we need to learn from this COVID and also eat healthy. So when that happens next time or in the future, this happens again, so we don't get harmed. And that's how we can prevent this disease from happening, right? Because it's scary. We don't want it to happen again, do we? But if it does, we need to be more prepared, right? Not every disease comes, we're not prepared for it. We know this can happen again in the future, so we need to be more prepared. But now we have a vaccine. This vaccine, you're not going to use all of it now. You're going to use some of it for next time. So next time, when if COVID comes again, so we have a vaccine. That's preparedness. Um, you have to be prepared when the disease comes, right? This was a surprise for us, but next time shouldn't be a surprise. Next time we need to be more prepared and making sure that can happen in 2, 3 years later. 4 years, I don't know. Might not happen, but we don't know yet, right? Might happen 10 centuries later. Maybe we're not going to be alive. Maybe we are, but if we are alive, we make sure that uh, we eat healthy. That's what's really important. And making sure you take your health because when you're 70 and 80, a lot of and majority of the people that are dead now are people who are elderly and people who are old, right? So you don't want to be 70 and 80 and there's a disease and then you're not eating. That's why when you're younger, it's very important you take care of your health by eating healthy, by drinking healthy, by doing everything healthy. Because by the time you reach old or you reach 80 or 70 years old, so your body is already developed healthness and your body's already healthy from the beginning. So it's not gonna catch much stuff because you feed it the time that you're young. But if the whole time you're just eating junk food and you're not eating healthy, you're not eating malnutrition stuff, then at the end of the day, um, they won't. It's very hard by the time you're 70 years old or 80, or if you're not healthy and you're not eating healthy and you have health problems. That's why old people have health. That's why old people have health problems, is because they didn't eat healthy when the time they're young. They didn't take care of their body. So I'm saying this COVID, I encourage the young people to do that because it's not too late. You can still develop your body, still you can eat healthy, and still you can do that. So by the time you get old, you don't have health problems. And health problems cause because people don't eat healthy food, they eat junk food, they eat other stuff that don't have health benefits. So it's very important that you just do that. You just do what's the right thing. You make sure that you protect your health. You take it very seriously. That's all I'm asking anybody to do. But again, this is people's decisions. Some people can follow this rules. Some people can't. Some people will listen to me when they watch the video. Some people are not going to listen. And I don't care who listens, who doesn't listen. But I'm advising people that if you don't want to have health problems the time you are 70 or 80, you better eat healthy now. So when you get to that age, you don't have to worry about any health problems or any kind of issues. That's all I'm saying, and straightforward, and everybody can do it. But that will take time. It's not going to be easy. I'm not saying it's going to be easy, but you have to. I'm saying even if you didn't eat sugar, eat maybe one sugar a day and the rest of it make it healthy because everything we eat is has sugar. We all know carbs and sugar and glucose. Everything has sugar. Everything, right? Even fruits and vegetables have sugar. But at least the fruits and vegetables, especially the fruits, they have health more benefits than the sugar has, and we need to do that. So that's what I'm saying. Because when you're young, if you eat healthy, anything if you do the time you're young, by the time you get old, you're not gonna have any kind of problems. But if you don't take care of your body by the time you're young, by the time you get old, you're gonna have health issues and have problems. And that's maybe those people that's why they died because some of these people they had health problems and they couldn't handle when you have and then if you already like have lung cancer and you have all already died and then on top of it you catch COVID, your body's not gonna handle to fight lung cancer and to fight COVID. Then you're gonna either go rush to the hospital, something can happen and die. So that's why I'm saying you don't want to have that kind of a problem in the future, right? Because this can happen again in the future, right? Can happen or cannot happen. But if it does happen, so we need to be prepared. We need to make sure that we eat healthy and we take care of our bodies. We make sure we don't joke around with our bodies. That's what's really important. And that's what I expect everybody to do, especially the young people. Like my age, I'm trying my best not to eat healthy and do all that because by the time I'm old, I don't want to have health problems. And if there's a disease too, I don't want to be catching it. It's better I eat healthy and take care of my body rather than uh, face that in the future. So that's why I'm saying that you need to do the right thing. You need to watch. You need to watch what you eat and how much sugar you eat, and that's what it is because You don't want to have that kind of a problem. When you have two disease or two health problems, people die because of that. Even one health problem can kill you, never mind having two health problems. So that's why I'm saying you do what's right. You protect your health, you do what you can, and you take it very seriously. That's all I'm asking everybody to do. And if you do that, things are going to go fine. But don't joke around with your health. Please take it seriously. Take it normal. Don't joke around. Don't look be like those people that don't wear a mask and they go out and they don't care, right? These people they did that. They went out. Now they're paying the price. Some of them got COVID because they didn't want to follow health rules. I'm not saying masks do anything. Masks they don't do anything. For me, I see masks as useless. But the reason I wear it is because I need to protect my health. I see my health is more important than I'll do anything to protect my health because my health I see is more important than my education and my school. That's what makes us live every day. That's what makes us be here every day. We need health. And the people that were joking around with the health, some people they joke around with health and they take it as a joke. Hopefully these people woke up now because this is not a joke now. Especially when you get it. It's not a joke. There's people that joke around, especially if there's people that joked around it and they got it themselves. And some people learned. Some people after that they took it serious, and there's people that still didn't take it serious. So it changed some people. It didn't change some people. So I'm just saying this is a wake up call for us. We shouldn't be surprised, but I'm saying in the future we need to be more prepared. And how we can be more prepared is to eat healthy and take care of our body. That's what we need to do, and that's what I expect everybody to do. Because if we do that, we're gonna go through this. If we don't do that, then it's going to be a problem. So please think about what I'm talking about because what I'm talking about is facts. I'm not joking around here. I'm being serious here. And if really if you care about your health this much, you need to care about it too. You don't go and joke around it and just do whatever you want and eat whatever I feel like and that's it. Even if you didn't have a sugar, have at least one bakery, either donut or muffin or anything, and have that and that's it and the rest of the day have healthy stuff. Don't have bread and all that because bread itself has sugar. Anything else have eat broccoli, eat carrots, eat vegetables, eat meat, eat protein. Have protein. Protein's healthy. Have milk. Just eat healthy stuff. And if you do that, trust me, time you are 70 or 80, you are going to be perfect. You're not gonna if you don't have no health problems and you're good, even when there's COVID and stuff, your body's gonna be able to fight it because it's healthy. It's not didn't eat junk and it did not you didn't feed it with diabetes and junk and food. You feed it with healthy food, right? So that's why it's really important you do that. But if you choose to eat tons of junks, and everybody makes their own decisions, I'm not telling people what they should eat, what they shouldn't eat. But for myself, that's what I'm doing because I don't want to have the time of 70 or 80 have health problems. I need to eat something healthy now, protect my health, and do what's right. And if you can do exercise, do exercise will be healthy. But the eating part is the most important part. You can't eat junk and expect you to do exercise and you're gonna stay healthy that way. No, the health part is the food part. If you have the food part, you're gonna be okay. And that's the key to this. So people can choose to listen to my advice or not. I'm not forcing anybody. But at the end of the day, your health and your benefits is what's really important. And that's what I will keep saying that that's what we need to learn from this COVID. And that's what I learned from COVID. I learned from this COVID that I need to eat healthy and take care of my body and also not joke around with my health. That's how I took my COVID. I don't know about you guys if what you learned from this COVID, maybe you learned different thing than me, but that's what I learned. I learned that my health benefit is more important. I need to take care of my health. I should not joke around with my health. That's what I learned, and that's what I need to continue to do. So that's what's really important, and that's what I advise people to do. But again, people choose what they feel like and what they're happy with, right? Because some people they don't care. They still see the health doesn't matter. They still can eat junk food. They can eat all type of stuff, and they don't see it's that important. And there's some people they didn't take it seriously. They didn't see it's really important. They didn't see it is really good, and they didn't take it seriously. So we have different variety of people here that take things differently. So it's up to you how you take things, but This is not force or forcement or do anything. This is your choice and your ability is what you choose. So that's all I have to say for today. I hope you stay healthy. I hope everybody stays healthy and hope everybody takes care of themselves. I take care of myself and I stay healthy also. And tomorrow, like I said, I will be live again at 8 o'clock, 20 a.m. tomorrow. So if anybody wants to watch tomorrow, I will be live tomorrow. And at that time, it's going to be really early. I'm not going to be live at 2:30. So if 2:30, if you decide to watch the video is going to be uploaded at 2:30, but it won't be live that time. So it will be live at 8:20 if you want to watch the video. Make sure you protect your health. Make sure you follow the health guidelines. You take care of your health as much as you can. Eat healthy food. Eat all type of health. And like I said, this COVID, I hope everybody took care of it. I hope everybody learned something from it because it's really important. It did a lot of damage for us during 1 year, and we need to learn from this COVID a lot, right? So take care of yourself, stay healthy, and do what you can, right? And we're gonna go through this, and hopefully, I'm hoping we're gonna go back to life normal, hopefully soon as possible. But we have to still follow the health rules and do what's right for us. We need to care about ourselves, and also we need to care about others, right? The most important, we need to care about others. We don't give people sickness that they don't deserve. We need to do what's right and protect ourselves and protect others, and that's it. We shouldn't do anything. Okay, and that's it. If you have any questions, I'm willing to answer right now. If you don't have any questions, I'm willing to let you go. And for my class, tomorrow you guys will have your unit exam, so make sure you do the unit exam. Like I said, your camera has to be on. It has to be all times on. And if I don't see it on, I'm going to give you a 0 for your unit exam. So make sure that you have it on at all times. That's what you need to make sure tomorrow you have. Exactly. Hopefully, if I understand what I'm talking about, right? And that's all I have to say for today. And like I said, the vaccine, I'm planning to get it um, by maybe by end of by maybe middle of March. I'm planning to get a vaccine that time, so we will see by that time. Maybe by that time I'll get it, or maybe even by April I'll get it. We will see, right? But I'll get it sometime. I will order some vaccines to come, and that'll be the Pfizer vaccine I'll be ordering, right? And that's all, right? And yes, tomorrow will be also the last day of the video, so make sure if you're planning to come tomorrow. Tomorrow is the last day of the video, and I'm starting really early tomorrow the video. So if you want to watch me live, you're gonna have to tune in at 8:20 a.m. If you're not planning to watch me live tomorrow, if you're gonna watch me just at 2:30 or not watch me at all, so that's your choice. But that's the plan and that's what it is. Okay. That's all I have to say for today. If you have any questions, I'm willing to answer it in the chat or verbally. But if you don't have any questions, if you have any questions about COVID-19 or anything, I'm willing to answer it. If you don't have any questions, then I'll let you go because I have things to do and I'm done talking for the day. I don't have any other topic to talk about or anything. So is there anybody who has questions about anything that I did not mention or you want me to mention instead? I guess I take it as nobody wants to answer, so that means there's no questions that needs to be answered. Okay. I hope everybody have a great day and see you tomorrow.